Hello everybody, I am Dr. Shrichand Parasramani, consultant dermatologist at Lilavati Hospital, Mumbai. This message is for World Cancer Day. Now, the cancers that we come across in dermatology are mainly basal cell carcinoma, squamous cell carcinoma and melanoma. Fortunately in our country, melanoma is very rare. This can start from a mole, and in case if the mole increases in size, it bleeds on touch, or if there is itching over there, then in this case it can turn into malignant melanoma, and this is a medical emergency because this is extremely dangerous for the patient. In such a case, we should refer the patient to the cancer specialist immediately and do not waste any time. Melanoma lesions should ideally not be biopsied, they should be completely removed. Now, basal cell carcinoma is the commonest skin cancer that we come across in dermatology, followed by squamous cell carcinoma. These lesions initially start as a small papule, nodule or a growth, and they go on increasing in size. It may be associated with pain, burning, or there may be an ulceration of these lesions can occur. Sometimes these lesions can start de novo, right on their own. And sometimes these lesions can start from pre-existing skin lesion such as erosive lichen planus, long-standing ulcers, then lichen sclerosis atropicans. So these are the lesions which always one should be very careful of, because these are also known as pre-malignant skin lesions. Then 1% of the population in our country can have oral lesions. These are basically pre-malignant oral lesions because they tend to consume pan, tobacco and gutka. These are the patients, they come with pain in the mouth, then they got ulcers in the mouth, they cannot eat, it hurts them, and these are extremely painful. Whenever we get such patients, we should immediately biopsy these lesions and then try to find out the cause. Once we know that these lesions are either squamous cell carcinoma, basal cell carcinoma, then they should be excised, and they should be excised with a small normal margin of the normal skin around it. And once these have been excised, then the patient should be followed up for at least 3 to 5 years. In some cases, we may even need to do PET scan at a later date to know if the disease has spread. Then nowadays, apart from excision, we have got other methods of treatment also. We have radiation, we have got chemotherapy and monoclonal antibodies. So all these patients should always be told that these lesions should never be ignored. They should always meet their doctor when anything unusual is seen, especially if the lesions are increasing in size and they have seen that it bleeds on touch, or whether there is pruritus, or whether there is any discharge. Then in such a case, patients should not ignore these skin lesions. They should immediately consult their doctor. Thank you.